Hello everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislin, and we're coming to you from our Hazleton location on the Beltway in Hazleton. Our phone number here is 570-453-2020. You can find us on the web, www.drkislin.com, and for those watching the Stroudsburg area, our phone number there, 570-421-3342, and we're located on 9th Street in Stroudsburg. Folks, we're starting outside today at our office because I want to take you on a tour. We recently went through a huge renovation at Hazleton Eye Specialist, and we're very proud of what we have to show you at our office. So I wanted to take you on a walking tour and show you all the technology we have, everything we've done to the office to better serve your eye care needs. We think we've done a great job. We have the most technology of any eye care facility in this area, and it's all to help our patients and serve your eye care needs. So follow me, let's go inside, and let's take a tour. So now we're inside, folks, and we're at the front desk area where patients will come in and be greeted warmly and check in. And we have a little bit of paperwork that you have to do when you check in, but a lot of our forms are found online now. So for our new patients, you can go to our website. Again, that's www.drkislin.com, and you can download the forms, bring them in with you. It kind of saves some time checking in. And we get the process moving along as quickly as we can to save time for you. If there's any questions about insurance, those can all be answered right at the front desk area here. So we move from the front desk area into our large waiting area. And for those of you that remember the office previously, this was much smaller. So we've expanded the waiting area to make it a little more warm and inviting. We've added a small refreshment center over here on the side where patients are welcome to grab a nice bottle of water if you're waiting and you're thirsty. We have a large screen TV where we put educational shows on about eye care. You'll see shows like Eyecare Today on there where we're talking about everything from glaucoma to dry eye disease. So this is our new waiting area, and hopefully we're not in here too long. And then one of my staff will then call you back into the pretest area. So let's go see the pretest area. So this is our first pretest room, and we have a couple great pieces of technology in here that I just wanted to show you. The first is what's called our OptoMap. This is a machine that takes a digital image of the back of the eye. We've talked about this a little bit in the past, but I just wanted to review this for folks. This, in a lot of cases, can eliminate the need for dilation. This takes a wide-angle view of the inside of the eye without having to put drops in. And just to show you an example of a picture that we have here, this is what a digital image of the retina looks like. And this patient actually came in with some symptoms of flashing lights, floating spots in their vision overnight, and they actually had a retinal detachment. So we were able to diagnose this very quickly with this instrument. We can view this, we can enlarge things and look all around inside the eye very easily. And this patient was hurried into surgery to save the vision. So technology like this plays an important role. Over here on my left, we have a machine called a specular microscope. And what this is, it's basically an ultrasound of the cornea. And the cornea is the front layer of the eye, and it actually measures the cells on the innermost layer of the cornea called the endothelium. And what we're seeing here, this is actually a contact lens wearer who came in over-wearing their contacts, and the cells in the cornea should all be little hexagonal shells that look like little stop signs. And there's thousands and thousands of these cells in the cornea, but what happens if someone overwears their contacts or they have some other types of corneal diseases, these cells actually start to die off, they change shape, and that's not a good thing. So as you can see on this picture here, a lot of these little cells outlined in green don't look at all like stop signs. Some are very large, some are very small, and in the other eye actually there's large area where there's actually no cells. The cells have actually dropped out and died. So that's not a good thing. So again, this is technology that we can pick up problems in a patient before they may even know it and save them some real problems down the road. So that's called specular microscopy. We're one of the only facilities in the area to have this technology. And then over on my left here, this is a very simple machine that actually takes a tear sample from the eye. It takes a tiny, it's called about the size of a microliter is how big it is. It's about half the size of a drop of tears, and this takes a small sample of tears and gives us a reading of something called osmolarity. And osmolarity is a measure of how dry the eyes are. Osmolarity basically tells me what the salt concentration of the tears is, tells me the actual makeup of the tears, and tells us whether or not patients have dry eyes or not. This technology is extremely important if someone has dry eyes, because it's kind of like going to the your family doctor if you have blood pressure. When you go to the family doctor, you need to have your blood pressure checked every time you go if you have high blood pressure. If you have dry eyes, you need to have your osmolarity checked at every visit so we can monitor your progress. So osmolarity is very, very important technology. We were the first ones in the area to have this technology, to bring this technology to the area, so we're very proud of that. So tear osmolarity is something that's very, very important. Our next piece of technology over here on my left is something called corneal topography. If you think of what a topographical map is of the ground or of a mountain, it shows us elevation changes. And this shows us elevation changes of the front of the eye, or the cornea. So there's a condition called keratoconus that affects the curvature of the cornea. And this corneal topographer, this is the latest technology in corneal topography out there, this takes a map of the front of the eye. So normally when we look at a cornea, we should see very subtle changes in elevation in the cornea. The outer edges of the cornea are very flat, and then they become gradually steeper toward the center. So we would normally see outer blues, and then some yellows and some greens and a little bit of red in the center. That's how a normal cornea looks. This patient came in complaining of poor vision. We did corneal topography, and this patient actually has a condition called keratoconus, where the cornea is actually shaped like a cone. And you can actually see on the very bottom here, you have blue up top and then steepening right down here on the bottom. So you have lots of yellows and some reds and greens down here. So this is a very steep area of the cornea right here. That's why this patient is having trouble seeing. They're fit with special contact lenses that we're actually going to talk about in another show called scleral lenses. So corneal topography, very, very important piece of technology. So right in this first room, folks, we have 1, 2, 3, 4 pieces of equipment that we're proud to say we're one of the first ones in the area to have. So these are all things that are going to help us take care of your eyes. So we're almost at the point for our first break. We're going to take a quick break here, listen to some commercial messages, and when we come back, we're going to continue our tour here at the new Hazleton Eye Specialists. We'll see you in a minute. Welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislin, and we're taking a walking tour in our new office in Hazleton. Again, our location here is on the Beltway, 281 Airport Road in Hazleton, 570-453-2020. Our website's www.drkislin.com. If there's any questions, please feel free to contact us. In our first segment, we started walking through into our pre-test areas, and we're in our second pre-test room that's actually used a lot. And I want to show you a piece of equipment that actually I don't know how I practiced without when we first got out of school. This technology wasn't even around 15 years ago. This is called an OCT, stands for Ocular Coherence Tomography. And this machine actually takes almost like a CT scan of the retina, which is the back of the eye. It looks at the layers inside the retina, the individual layers of the retina, and tells us if there's any abnormalities. And on this picture right here, this is a picture of a patient who actually has diabetes, and they came in complaining that their vision just wasn't right. And what we actually see here are some layers of the retina. This is a bottom layer, and these little black areas or pockets are cysts of fluid. And this fluid in there is pushing up the retina. This elevation right here you can see is the fluid inside pushing up the retina, causing the vision to be bad. this actually should not only be flat, actually there should be a dent in this that actually goes down. That's normally how the retina looks. So this is a pocket of fluid from diabetes. This patient was referred immediately to Dr. Patel, who's our retina specialist, and for some prompt treatment to help save the vision. So an incredible piece of technology that, again, I don't know how we practiced without years ago. So let's move on to our next piece of technology. All right, folks, we're going to continue our tour. We're on the one side of the office where Dr. Diem and Wozmansky see patients mostly. We have 4 exam rooms on this side of the office, and everything is kind of shaped in almost like a horseshoe. So patients will come through here, and then they'll proceed after they're seen on this side. If they're seeing Dr. Wozmansky or Dr. Diem, they'll proceed around the checkout. And I want to take you on a tour here through the office and over to the side of the office that I usually see patients on. But we're going to stop in our dry eye treatment room just to point out a couple things in this room. As you know, we do a lot of dry eye treatment at Hazleton Eye Specialists and Strasbourg Eye Specialists. This is a room that's really dedicated to our dry eye treatments. We have 2 pieces of technology. As you know, we've talked about LipiFlow in the past that provides thermal pulsation to the eyelids and the glands in the lids for dry eyes. And we also have another new piece of technology. It's called Mibo Thermoflow. We are the only ones in the area to have this new technology. This machine provides ultrasonic heat to the eyelids that help the glands in the lids to secrete better oils and better tears. So these 2 pieces of technology can be very, very beneficial for patients with dry eye disease. So we're very fortunate to have an area dedicated to these 2 great pieces of technology. So as we move down the hall here, we're going to proceed through some other exam areas. And again, this is the side of the office where I usually see patients. We have 5 exam rooms on this side of the office. And I want to take you into a room that we have a machine called an anterior segment camera. So this is a great piece of technology. It doesn't look very big. It's actually this piece of equipment right here that's mounted to our machine called a slit lamp. So this is the microscope that we use to look inside the eye, but we have this piece mounted to it. This is actually a still and video camera. We can take images of the eye. And the reason this is important is to basically document things that we may see in patients, to document progression of how someone's improving in their vision, or to actually take pictures of some problems a patient may have where we actually have to make a referral to document it, or just to show the patient what's going on. And very interestingly, we had one patient come in a couple weeks ago, cleaning out their garage, all of a sudden felt like something was in the eye. Their eyes were really bothering them, and actually had a large piece of wood stuck up under their lid into their cornea. And I just wanted to show you the picture here. Now, just to kind of orient you what we're looking at, we actually put yellow dye into the eye to kind of highlight what we're seeing, and then we look with a special blue light. But right here, this line right here, this highlighted line, is actually dye that's absorbed into a large splinter. And that's what the patient had lodged in their eye. So that was actually pretty easy to remove. We numb the eye and remove that. But that's the kind of thing then that we can show a patient so they kind of understand what's going on and maybe why their eye hurts and what we're doing. And also, not all technology is big. Some great technology can be small. This piece of technology right here is called a B-scan. This is an ultrasound that allows me to look inside and through the eye back to the retina. So this is just like an ultrasound. If someone, maybe is pregnant and they're going to have an ultrasound of their baby, same type of ultrasound, except this is for the eye. And it's very simple. With the eye closed, we just very gently place the ultrasound on the front of the eye, and it gives me an image, an ultrasound image inside the eye, and I can look and see if there's any retinal detachment. I can see if there's any tears in the eye. I can see any abnormalities in the jelly inside the eye that maybe I'm not able to see just directly looking into the eye. So again, a great piece of technology that we have here at Hazleton Eye Specialists. So we're going to continue our tour. We're going to move out toward the checkout area here, and What I'm very proud about here at Hazleton Eye Specialists, besides providing a ton of medical care for the eyes, we obviously have to make patients see better. And sometimes we do that with glasses, sometimes we do that with contact lenses. And after patients check out, they're brought into our new optical area. And I'm very proud of this optical area. I think it really turned out very nice. We're proud to say that we have the most frames available of anyone in the Hazleton area. The selection here is fantastic. We have everything from brand name frames, Polo, Ralph Lauren, Coach, Vera Bradley, all the way down to frames that fit any budget for patients. We have sunglasses, Oakley sunglasses, Ray-Bans. So, you know, it's important that your eyes are healthy. It's also important that patients see clearly. And patients want to look good seeing well. So the expansive optical area that we have really can help patients no matter their budget. What we're very proud of also here is our staff is very well trained in taking all the measurements necessary to make a patient see well, whether they just need glasses for driving, whether they need glasses for reading, whether they need no-line bifocals. It's very important that the frames fit well. It's very important that the measurements are taken properly so that the patients can see well. So our optical area allows us to do that. Patients, once they pick out their frames, they're seated at one of the desks here. The staff talks to them about lens options, and then the patient briefly will come over to this machine. And this is very interesting. This is a machine that actually helps us take all the measurements that are needed to tell us where the optical centers are, where the bifocal height goes in the glasses. And very simply, once this is on and going, the patient stands in front of this and basically just looks straight into the camera, and this takes all the measurements. The patient doesn't have to do anything. So again, a piece of equipment like this really, from a technology standpoint, can really pinpoint with extreme accuracy what measurements we need for patients' glasses. So it's time for another quick break, folks. And when we come back, we're going to look at our specialty suite here at Hazleton Eye Specialists. We'll see you in a minute. Welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislin, and we're at our Hazleton location, our new location, Hazleton Eye Specialists on the Beltway in Hazleton, 281 Airport Road. Our phone number here is 570-453-2020. If there's any questions, please feel free to give us a call. For those watching in Stroudsburg, 570-421-3342 is our phone number there, and we're located on 9th Street in Stroudsburg. And again, we're taking a walking tour of our office here. It was about a 7-month renovation, and for those patients who were here during the renovations, I'm sure you remember all the banging on the walls and the tarps put up and everything. So I'm very thankful to our patients who kind of hung with us and went through all that with us, because I think what we have here to offer everybody is we're very proud of. So where we are right now is we're in our specialty section of the office. So if when you're getting your eyes checked and we maybe find a problem such as cataracts or a retinal problem, you need to see one of our specialists, Dr. Bucci, who's our cornea, cataract, and refractive surgeon, or Dr. Patel, who's our retina specialist. This is the side of the office where you're actually going to come in. You're going to come in through the main door, and then the staff will ask you to proceed down to this area where we actually have a separate waiting area. Nice comfortable waiting area. We have a separate check-in area for patients. And again, if you remember before our renovations, it was kind of crowded with myself and the other doctors seeing patients with either Dr. Bucci or Dr. Patel at the same time. So this really offers patients a nice open environment and an area where they can be seen very easily by our specialists. So we're going to move down the hall here. We actually have 5 exam rooms on this side of the office also for our specialists. So we're very proud again of the equipment that we have. And I want to actually look specifically at 2 pieces of equipment that really can help patients with some eye conditions. The first is if a patient actually has certain retinal problems such as diabetes, macular degeneration, one of the treatments may actually be laser treatment or laser surgery. And years ago this had to be done in a hospital and patients had to go through a lot of red tape just to get this done. Well, now we can actually offer this right in the office. So we can do in-office laser treatment for the patient, so it's very quick and easy, painless. So if that's necessary, we do that right here in the office. One of the other treatments many of you may know for macular degeneration are injections of medicine that actually go right into the eye. Again, they can be done right here in the office, so patients don't have to go anywhere else. They can have that done right here with Dr. Patel. This piece of equipment right here is brand new. We are the only office in the area that has this, and the closest other one into the area is actually Reading, down toward the Philadelphia area. This is called Dark Adaptation, and the name of the company that makes it is Maculogics. And what this helps us do is determine whether or not a patient has problems with their retina as far as their dark adaptation. And the reason that's important is because we found that in macular degeneration, the retina, and specifically the rods and cones in the retina, the way they talk to each other is not very good. And dark adaptation tells us whether or not a patient has early macular degeneration before we can even see it by looking into the eye. So this is a very simple test. We do have to dilate the eyes to do this. The patients will come in and they actually look into this machine. There's a red light they look at, very simple, and it takes about 6-7 minutes an eye. And this tells us how the rods and cones talk to each other inside the eye. So if a patient actually has a problem with their dark adaptation, it will actually tell us whether or not the patient has early macular degeneration, and we can talk to them about possibly changing their diet. If they're smokers, they should stop smoking, obviously. We can talk to them about any nutritional supplements they may need, whether it be vitamins or any other supplements, omega-3s, things like that. So dark adaptation is becoming a very important piece of the puzzle in diagnosing macular degeneration for patients. So again, we're very proud to be the only ones in the area. No one in the Wilkes-Barre-Scranton area has this. No one in the Williamsport area. Nobody else has this. So we're very proud to have this in the Hazleton area. So we're going to take a quick break here, and we're going to move to the other side of the office, and I'd like to show you some more technology. We're now in one of the specialty rooms in the retinal side of our clinic here at Hazleton Eye Specialists. And I want to point out two pieces of equipment here that are very important, again, to our patients who have any retinal problems or problems with the back of the eye. On our first segment of the show, we talked about a machine called an OCT. This is actually a different company that makes an OCT, but it really is even higher up in technology than the one we previously talked about. And Dr. Patel uses this extensively to actually look at the retina at the back of the eye, and again tells us if there's any fluid inside the eye. And laser treatments can also be done through this piece of equipment. We also do, between this piece of equipment and this piece of equipment right here called a fluorescein angiography, we can actually see what's going on with the blood vessels inside the retina. The patient actually will have a little bit of orange dye injected into their arm, and that dye goes up all the way through the arm, up into the head, up into the eyes, and we take a series of pictures of all this dye inside the eye, and it tells us actually what blood vessels are healthy or what blood vessels are not healthy, and that will help guide the laser that we talked about earlier as far as treatment inside the eyes. So again, we're very fortunate to have this type of equipment here right in the Hazleton area. In other cases, patients have to go up into the Wilkes-Barre-Scranton area for this technology, but now that we have this here in Hazleton, patients do not. They just stay right here in the Hazleton area and can have this done. So we're very fortunate to have this piece of technology. So we're going to move out into the front area of the office, and we're going to wrap up the show. So as we wrap up this show, folks, we took a walking tour of our new office that we're very proud of here at Hazleton Eye Specialists. This was about a 6-7 month project that our patients and staff endured for us to provide the best level of care possible here in the Hazleton area. We walked through all the parts of our office, showed you all the technology that we have here. The rooms that Dr. Wozmansky, Dr. Diem use, the rooms that I use for our dry eye treatment and our examination. We looked at the expansive optical area that we're proud to be the biggest optical area of anyone here in the Hazleton area. We looked at our specialty suite where Dr. Bucci and Dr. Patel see patients for cataract issues, LASIK issues, retinal problems. So we went through the whole office. You're able to see everything that we have here to offer at Hazleton Eye Specialists. Again, we're very proud of what we have to offer our patients here. If there's ever any questions about anything we discussed on the show, please feel free to contact us. Our phone number here is 570-453-2020. Again, you can catch us on the web, www.drkislin.com. Again, I'm your host, Dr. Thomas Kislin. We'll see you next time on Eyecare Today.